Well, Tony Stein is the CEO of Healthcare Management Solutions, who run a number of hair combs across the UK, including Larchwood Care in Cardiff and Newport and Red Rose Care in Ebbw Vale. And Ellen Jones is the Wales Director for the Royal Pharmaceutical Society. Good morning to you both.
Good morning.
Morning.
Tony, let me come to you first then. In terms of the speed of the vaccine rollout here in Wales, what is your view on it?
Morning, Claire. The speed, it's obviously picking up a pace as we speak. It started off, as all these things do, relatively slowly. I think there was a lot of organisation to take place. The one thing that's held us back a little bit was the access to the vaccination centres. For example, one of our homes, they were offered vaccinations, but at a centre that was 16 miles away. So that meant that not all the staff could get done as quickly as we'd have wanted. But we're now happily in a position where 28% of our residents, that's Red Rose, all the residents have been done with the Oxford vaccine. And our staff, we've got somewhere in the order of 95% of the staff in one home, 27% of the staff in another, and we're just waiting for the date for the third.
And how soon could that be?
It's moving very quickly.
How soon could that be? And in terms of logistics, you mentioned that 16 miles, is quite far for people to travel for the vaccine. Any other bumps in the road?
Not really. I think everything seems to depend on where we can get the vaccines done. I mean, if we can get them vaccinated actually at work or actually at the home, it's much simpler, and it takes place very, very quickly. And I think the news that they're going to increase the number of vaccination centres is going to make a massive difference. What I will say is that we've got 70 care homes of 2,700 residents across the UK, and Wales at the moment are slightly ahead in terms of percentage of people vaccinated. So it's all very much dependent on location.
Yeah, and in terms of the experience for you so far, I mean, how do we make it more efficient, even more efficient? I mean, in terms of administering it, what needs to be done, in your opinion, Tony?
It's not so much of what needs to be done. I think it is literally about where it can be done. And that's very much dependent on where your homes are situated. In our case, our home, should I say, and where you personally are situated. I think the whole process of rolling out vaccination is about getting as many centres as you can, as close to the population as you can. So if you're asking people to, I mean, my mother, for example, she lives in Bromsgrove in England, and she's been offered a vaccination in Birmingham. Well, Birmingham is very difficult for her to get to, and she's over 80, so she's not going to get vaccinated at the centre where she's been offered it now. She's going to have to wait until somebody can come to her at home because she's not particularly mobile. And that seems to be the issue about the vaccination to me. It was particularly difficult with the Pfizer vaccine because of the way it had to be stored. So the Oxford vaccine makes that much easier. You can actually get that out to the population a lot easier.
Yeah, and Ellen, just to bring you in here, in terms of what we're hearing about this date, the autumn, from your point of view, how do you feel? Are you confident we'll all be offered a coronavirus vaccine, by September?
Well, I think from our point of view, pharmacists have already been involved in the delivery of vaccination programme at a strategic level, and many working in the mass vaccination centres. And community pharmacy does offer a huge opportunity to increase the amount of sites and localities that the vaccine could be available. So although I know the transit teams, like other frontline NHS workers, have been feeling the strain throughout the pandemic, there has been overwhelming positivity from our community pharmacy members and a desire to continue doing more to help beat this health crisis. So community pharmacists are willing and skilled to help deliver the vaccination programme, as they do with flu every year. And I think, Tony's picked up on a really important point there about how difficult it can be to get to some localities, and the network of over 700 community pharmacies in Wales, and there's also that opportunity for people to be receiving vaccinations at a more local level when there are enough vaccines in the system to be able to do that.
Yeah, and clearly pharmacists, are there on the sidelines, many of them, hoping to play a greater role. I mean, have you been concerned, Ellen, about the speed so far?
So we have had a lot of calls from our community pharmacy members in particular over the last week or so that are really eager to get involved. And I really welcome the intention today that there will be a COVID vaccination plan so that people know timelines. We do understand the complexity of the system, and it's not as straightforward as the flu vaccine, which we've been doing for many years. But the positivity for us is that 86% of community pharmacies in Wales have been offering the flu vaccination service this year, with a significant increase in the amount of vaccinations being delivered in 2020 compared to 2019, even on top of all the pressures that they've been experiencing during the pandemic.
Yeah, and you can understand frustration, though, can't you? Many people feeling, there are the thought of thousands of vaccines in fridges across Wales, 200,000 vaccines in fridges, and just sat there and waiting to be administered.
And I think this is where the plan definitely will be helpful for us to understand the intention on getting those out to GP practices and hopefully community pharmacies as well. We are pleased that there is a clear intention from Welsh Government to utilise the skills of community pharmacy teams. We know that the service specification is in place involving primary care providers, including community pharmacies. So we encourage and welcome that rollout.
And Ellen, lots of talk about whether there should be a vaccination minister for Wales. I mean, would that have an impact? Does that matter?
Well, that is something that has been discussed at length. I think, the way the Welsh Government are operating at the moment, that there is a lot of positivity in the way that they are going about including primary care. So we are pleased from that point of view with how the progress is happening in Wales. And it's difficult really to weigh yet the pros and cons of what that additional support could offer. I think once we see the COVID vaccination plan today, we will have further reassurance, I think, of how the plan will work.
And Tony, just finally to bring you in here, I mean, Vaughan Gething was on BBC Radio Wales and admitted, looking at the data, Wales slightly behind the population share and said the race isn't against other UK nations, it's a race against the vaccine. But keen to hear and interesting your experience in terms of you running care homes in Wales and England. Wales, you were hinting doing slightly better.
Bizarrely for us, but as I said, everything depends upon location, Claire. I mean, if you're in a well-populated area close to centres, it's very, very simple. Wales is a very rural kind of environment for a lot of it, so it's not so easy to get to a vaccination centre. A lot of our other homes are based around major cities in England and Scotland, in fact. So it really does depend where you are and how close those centres are. And I really, think Ellen's point about pharmacies getting involved is absolutely fantastic. If we can get the vaccination out to more centres closer to the population, this will happen much, much quicker. I mean, in fairness, we're talking now about the difference between England and Wales and Scotland is so small in terms of numbers or percentage of population vaccinated, and we're still in the first few weeks, literally, of the vaccination program. So, I have a very, very strong feeling that certainly for us, our residents and our staff will be vaccinated by mid-February. I'm certain of it. The way that they're starting to invite us to go for vaccination. Whether we're finished by autumn for all adults in the UK, I'm not sure. But at this speed, I wouldn't be surprised.
Tony and Ellen, really good to hear your thoughts on this. Thank you very much for joining us.